This is the Emergency Medical Minute, sponsored by Health One.
The concerns for COVID and PPE have brought about a resurgence of interest in the personal protective equipment that we all depend upon. In that light, I thought I'd talk a little bit about the origins of PPE. When you look at old movies and you see pictures of surgeries that occurred during the Civil War period, you recognize that there really wasn't a lot of protection offered to either the patients or the physicians or other practicing personnel regarding exposure to infection and bloodborne products. As it turns out, the advent of gloves we can attribute to a surgeon by the name of William Halsted. Now, William Halsted wasn't the only person involved in this. Halsted has a very interesting and somewhat checkered career. He was a scientist, and in his pursuit of investigating a topical anesthetic called cocaine, decided to inject himself with it and actually became addicted to it, undergoing a couple of different rehab stints and eventually transitioning to morphine. But as a result of that, ended up at Johns Hopkins University, where he gained renown for several things, not the least of which was his teaching prowess. The interesting event that occurred to promulgate the development of protective equipment, and specifically gloves, came about because his chief surgical nurse, a woman named Hampton, found it very caustic to clean her hands through a regimen of potassium iodide and an acid wash and mercury that Halsted demanded of all those who participated in his surgeries. Her skin became very irritated, and as a result, Halsted developed the rubber gloves for her using hand casts and going to the Goodyear Rubber Company to develop some specific gloves. As a result, the gloves caught on with the surgical staff and eventually became much more popular at the end of the 19th century, to the point that by the early 20th century, about half of surgeons were using rubber gloves. As it turned out, the next logical step was the use of masks, and again by about 1919, half of the surgeons were also using masks, thereby protecting themselves as well as their patients from the potential for infection. The resultant use of those personal protective gear drastically reduced the complications and morbidity of infection, lowering mortality rates to an unheard of level. Curiously, as it turned out, Halsted and his nurse, Hampton, developed a love affair and eventually became married. And unfortunately, sadly, it's rumored that Carolyn also succumbed to the ravages of morphine. But we do have them to thank for rubber gloves and ultimately the development of the first personal protective equipment that we all depend upon now, and in the light of COVID days, certainly can appreciate. The information for this bit of historical information actually comes from a podcast by a gentleman named Sam Kane, who I recently discovered when I read his book called The Disappearing Spoon. Mr. Kane has a podcast, and I extracted the information for this particular medical minute from that podcast.
Hello, I'm Dr. Stephen Bradley, anesthesiologist and U.S. Naval officer. I'm also the host and creator of the Black Doctors podcast. This podcast provides weekly 30-minute episodes that tell the stories of minority healthcare professionals. It is my hope that hearing these unique and inspiring stories will encourage others to consider pursuing these challenging and rewarding career paths. So please join me for the Black Doctors podcast. Available on Apple Podcast, Spotify, and all major streaming platforms.